Welcome to another episode of Vet Candy Life. I'm Renee Machel.
And I am Dr. Quincy Hawley.
This show is brought to you by Merck Animal Health, makers of Nobivac vaccines.
Dogs' lives are unique. Their protection should be too. That's why you should choose Nobivac vaccines for one-of-a-kind protection against leptospirosis. For a one-of-a-kind leptospirosis protection for every kind of lifestyle, choose Nobivac vaccines. Want to learn more? Visit stoplepto.com.
Welcome back to another episode of Vet Candy Life. I'm Renee Machel.
And I am Dr. Quincy Hawley.
Today on this episode, we're going to be talking about parenting.
That's right, parenting. So tell me, do you have kids?
I have kids. I have two boys. One is 9, one is an infant.
Okay.
Awesome.
How about,
and you've got girls?
I've got two girls, two beautiful little girls. Cadence is 5 and Sky is 2 years old.
Yeah.
Yeah, and they're a handful. Like all kids, I imagine, they are a handful. They give me a hard time. They give me a run for my money every single day, but I love it.
Yes.
Yeah. Okay. What's one of your favorite parts about having kids before we move into some more difficult stuff?
My favorite parts about having kids right now is that I'm at a place in my life where my well-being has been in such a focus that their presence in my life creates joy. And alternatively would be as, an unwell Renee having children, their existence in my life would fuel anxiety and fear.
Yes.
I was just thinking about that this very morning, woke up, was watching, G sort of just do his morning thing. And I really was just melting into that moment. And I thought to myself, what would this look like if I wasn't well?
That's a really good point, and your life is so different as a parent versus a non-parent.
Yeah.
Like our lives completely changed as a married couple when Cadence came into the picture because everywhere we go, she has to go.
Yeah.
Right? We can't just go out on the little dates and stuff like that anymore. And it's hard to believe that some parents actually look at their kids like a pain in the you-know-what, right? Because that makes a huge difference if every day when you wake up, you're thinking about your kids as, oh my God, like another day of them terrorizing my life, basically.
Yeah.
And destroying your man cave.
Right?
Yeah.
Encroaching on your space.
Yeah.
But, you're right. I think it's just, they take from us a little bit.
Right.
As far as like you're the leader, and so they roll with that. And so if you're, chaotic in your energy, they pick up on that kind of stuff.
They really do pick up on that. And before we move on to screen time, I want to talk about screen time today. I'm going to tell you my favorite part about having kids. My favorite part is looking at them and seeing myself in them. Like the good and the bad, like the mischievousness of it all, and then also the creativity. And I just try not to get in their way too much and let them develop into the happy children that they're going to be someday. Yeah.
That is so insightful.
Yeah.
Not to get in their way too much.
That's important. And I believe that, I've had situations where sometimes students or even veterinary professionals will tell me where they had bad relationships with their parents, when their parents were abusive and things like that. And so I'm just thinking to myself, I don't have to be an all-star dad. I just have to not mess up, basically.
Right.
And allow them to,
Yeah. To develop.
To develop on their own.
Right.
Okay, let's talk about screen time.
Yeah.
What do you think about screen time?
I look to you sometimes for those cues because that, I just have this tendency, like, you want to jump in. So I appreciate that a lot. Screen time, that's another one of those things. So I want to probably have more control over their screen time than what they would enjoy, right? I try to balance it. I try to balance it for the week, for the days. I think the maybe the American Medical Association for Pediatrics, they recommend about 2 hours of screen time.
Okay.
For developing age children, and so that's one guidepost that you can go with. I think everything should be taken as a guide, based on your situation.
Sure. Sure. I honestly believe that my kids are far superseding 2 hours, especially with a lot of the virtual school and things like that they're doing now with homeschool. Yep.
Well, and I think I suppose we're coming in these different times. Everything changes, because 20 years ago, did they even have statistics like that? Because I remember,
probably not.
I grew up playing video games, but I don't know at what age, I was allowed to, play on my own or things like that. So.
But this is a time where screens have become a part of our everyday life.
Yes.
And if I think about my house in and of itself, we've got a screen, sometimes 2 or 3 screens in every single room. You've got the Alexa show or whatever. You've got a TV on the wall, and then you've got 2 cell phones on the nightstands, and then you've got the tablet, the Kindle tablet.
So
thing.
Do you guys have any practices? What about eating? Like, do you guys? That's a thing. So screen time in and of itself is one thing, right?
Yeah.
But what about eating? Do you guys allow screens for eating?
Of course.
Okay. Daily or just occasionally, or just every day is different?
It's about every day. So my routine is to escape the kids. So I turn the TV on, I put food on their tables, and it's not a very good routine, and I don't condone this, but I turn it on and then I go and I try to multitask and maybe do the laundry or clean up because
the parenting
I've been working all day, right? And so there's the self-care aspect of parenting where you have to give yourself that space. And sometimes it's hard to do that if you're going to sit down and watch or sit down and have the hour-long dinner. But again, as we mentioned maybe on a previous episode, that it's important to have the introspection, to do your homework, and to really get creative and try to figure that out.
Yeah. I really appreciate that. I think that's a really big part of things is, just balancing things.
Right. Yep. And, when I think about another issue that sort of comes up is with parenting is maybe mom wants one thing and dad wants another. Have you ever had any issues where, okay, go ahead.
Yeah, are you guys in alignment on the screen time?
Probably not as much as we could be.
Okay.
So I prefer to give them access because a lot of the shows are so educational, right? And then I understand that me having my space is important for my happiness, and my happiness will contribute to the kids' happiness, as we sort of talked about earlier, versus like stressing myself out trying to do everything with the kids. And I know that's not ideal, but it's kind of the way I'm looking at it. It's like, what's best for dad, right? The best thing I can do for somebody else is to take care of my own personal well-being. That's one of my favorite quotes of all time. And so I really try to live that and make sure that
the screen
I'm sort of getting what I need.
Helps to facilitate that.
And they don't mind it. So they're in good spirits. And I'm sure that there's research to say that maybe it's bad in one way or another. But at the same time, could we look back in 10, 15, 20 years and say screen time was actually good for them? Maybe. I don't know.
Yeah.
Don't quote me on that.
Well, once upon a time, doctors smoked.
Really?
Yeah. Once upon a time, doctors smoked, and they said it was healthy for you. This was a very long time ago.
What?
Yes, this was a very long time ago before they started researching the negative effects of it. So, who knows?
Right. And that actually brings me to my next point: is that nobody knows how to parent. Like, where would you find out? You're asking other people who probably don't even know either.
Well, that's a part of it, is that growth.
You're not born with this knowledge of knowing how to be a parent.
Yeah,
and
it's
so
intuitive.
To me, it's okay to mess up and make mistakes. Like, is, giving a whooping to your kid a bad thing or a good thing? My dad would say, it's definitely good. Look at you, son, you turned out okay, right? But now I think you might go to jail or something, so, right? Like, I don't know.
Oh man, that brings something up for me, is that with the infant is finding daycare. I was reading the other day is that finding daycare that's both affordable and high quality,
Yes.
it's hard. The statistic that I had read was 62% of people, find it difficult to find affordable and high quality daycare.
I can see that. That makes sense. Yeah. And I imagine it's more difficult if you're from a smaller town as opposed to maybe like a larger city where there are more options and things like that. But we actually got really lucky with a neighbor who was right like 1 minute down the road. It's the most convenient thing ever. And so I would say to any parents out there, whether you're in the veterinary profession or some other profession, that if you can find healthcare that's close by your house that will save you 30 minutes of a drive, it's probably worth it. And our other option was to pay twice as much, 30 minutes away.
Right.
So that would have been 30 minutes there, 30 minutes back every single day. That's an extra hour of driving
every day.
An extra hour of the kids being on the road, car accidents,
7 hours a week,
stressing out, and they would get more screen time because I'm going to hand them the tablet so they don't scream the whole time.
And you find it safe. It's high quality, right?
Yeah. You obviously have to do your due diligence. You have to do your research, right? You don't want to just say, okay, you're a minute down the road, so I'm going to go with you. But do some homework. And nowadays with the internet, with Google.
Yeah. That's really good. That's really good information, because I think when you're starting out, if you're a new parent, you don't even know where to begin. And if you come up and you have, okay, I've got these 5 different options, what do I do to prioritize those options? So I think that's really important.
Right. And there's one more point I want to touch on, because I've experienced this sort of personally in my relationship with parenting, my wife and I. But oftentimes I believe one parent, or maybe even both parents, can give themselves such a hard time over whether they're doing a good job or not. And when I look at my wife and I think I'm the world's #1 dad, and I just, again, throw the cat in there with my daughter to do the homeschool and things like that, versus my wife, she's giving like such a good effort, and sometimes she'll think she's doing a bad job, and she's doing 10 times more than what I'm doing.
So she's doing a good job.
She's doing a really good job, but she thinks she's doing a worse job. And so my advice to everyone out there would be, whatever you're doing is probably enough. You know your intention, you're good.
Yes, I just had a conversation with a colleague of ours, and he said, especially for new parents, but even parents who have, veteran, seasoned parents, right, is that sometimes good is good enough.
Oh, for sure, it's good enough. For sure. Perfectionism
aside, good is good enough.
I think about that song from Grease. I think it's like Rizzo, she sings it. Like, there are worse things I could do. There are worse things you could do as a parent, okay? You're probably doing a really good job. So, thumbs up to you and to you. What?
High five.
Seriously,
Parents.
Seriously. Yes.
I like it.
And something funny that I think about all the time is, like, our parents and the way they raised us. Compared I don't want to get my parents in trouble, but, like, okay, maybe we shouldn't go there. I'm going to go there. So, the little plug-in things to the outlets, that
like child-proofing things?
Yeah. I never saw one of those until I was a parent.
Oh, right.
And we had outlets everywhere.
And you made it.
How did they prevent us from sticking all types of stuff in there? Was that a thing?
All different things. Well, car seats. I mean, we grew up in the,
True.
Car seats have evolved. Seatbelt laws have evolved. You ride in the back of your dad's pickup truck. That law has evolved. All sorts of things have changed. But yeah, we survived it.
Yeah.
And not only did we survive, we thrived.
Yes, I'm happy to be a parent.
Yes,
I'm happy to be a parent.
It is. It's really fun. It really is. It's I'm grateful to be in the parenting club.
That's right. Me too.
Yeah.
It has its pros and cons for sure, but more pros than cons.
Yeah, definitely. I agree.
Yeah.
Hey everyone, we are here today with Maria Sanders, and she is a parenting coach. Maria, can you tell me a little about yourself and tell us more about what it's like to be a parenting coach?
So I'm a licensed social worker and a parent coach, and basically what I do is I work with parents who are experiencing some sort of challenge with their kids. So whether their kids are 2 or 12, I'm here to help guide them into getting through either a single challenge or multiple challenges. And what is it like? I really think it's a lot of fun, because although we're talking about problems and challenges, we're also starting to see hope, and we start to see change as I work with the parents to set goals and start to figure out how we're going to start reaching those goals. So we use a lot of positive psychology to move forward.
That's fantastic. You know, as a parenting coach, what would you say that every parent needs to know? Like, if there were 3 big secrets to what every parent needs to know, you know, could you share that based on your experience?
Absolutely. So I would say the first one is that it starts with you as the parent. And that's not meant to blame or shame anyone. Instead, it's meant to empower us to know that a lot of what we're experiencing, our internal landscape, comes out externally. And so we really have to bring some mindfulness and awareness to what's going on in our daily lives, what's going on in our thoughts. Because once we can start bringing awareness into our thoughts and our feelings, we can start shifting what happens on the outside in how we're speaking to our kids and how we're interacting with them and how we're really just connecting and engaging with them. So I would say that's the first thing. The second thing, which sounds easy, but it's actually more difficult than it is your breath. Your breath is your barometer. It's your clue to tell you what is going on. If you take a notice of how you're breathing and you have some shallow breath, that might be a sign that there's some anxiety or some frustration or something going on that just doesn't feel right. And so your breaths should be long and deep. And if they are short, then start taking in some longer, deep breaths. By doing that, it also allows us to take a pause. A lot of times we react. We have knee-jerk reactions. Our kids ask us for something and we quickly reply back. Maybe they're fighting and we quickly get involved and we have a quick reaction. We want to slow things down, and using our breath helps to slow everything down and kind of put in a place of calm. And then the third thing that I think is really important, and I think it might actually be the most important, is to remember that relationship is key. That everything we do as a parent, everything that we say to our kids, everything that motivates us to work towards change needs to start with the relationship. And so we want to make sure that we have a connected relationship where we are really working with our kids collaboratively in a way that we respect one another. We're here to listen to one another and make sure that everyone's voices are heard. And the only way we can move forward is with the foundation of a strong relationship.
That is powerful. That aligns so succinctly with the focus of well-being and parenting. But wow, that's gold. That is gold. You know, but I think as parents, we get caught up in the grades meaning more or the chores meaning more, you know, but like you said, without that foundation, and the rest will come, right? When that foundation is laid, the rest comes really organically, and maybe you don't have to work as hard as the other stuff. You know, if you're having a really good day and you're vibing with your son or your daughter and you're like, hey, can you take out the trash? They're like, sure, mom, no problem. And, you know, they run off and do it. But if you're not vibing on that relationship front, then you ask them something really simple. Hey, are you ready to go take a shower for the end of the night? And all of a sudden it's, you know, just chaos.
Yeah,
so,
they say you get more bees with honey, and there's truth to that. Mm-hmm. The relationship will help you, especially when things are difficult. When things are difficult, it's the relationship that you're going to fall back on to help support you to move forward.
That's that foundation. You are spot on. That is fantastic. Thank you so much for sharing that with us, Maria. Man, that just fuels me. That fuels me. It inspires me to continue focusing on the relationships in the household. So as a parent coach, what's the number one thing that you would like for other parents to be aware of, or that you would like for them to know?
That repair really can change the trajectory. And what I mean by that is, a lot of times as parents, we end up fighting with our kids, we punish our kids, we yell at our kids, and that causes a rupture. And that happens. We're human, we all make mistakes, even when we're trying to do things differently. What comes after that, what's really important, is the repair. It's taking that moment to say, hey, buddy, I snapped at you and that wasn't okay. Or, you know what? I wasn't really happy with the way I handled myself. Can I get a do-over? And working towards repairing whatever just happened actually makes structural changes in the brain, and it makes huge changes for the relationship. So take the time to create a repair if there's been a rupture.
That's really impressive. You know, I'm lingering on what you had said, that there's physical changes in the brain. And so I think a lot of us, you know, we lean into the evidence of that tangible side of things. So, you know, it gives us even more reason to do those things, because you can't always, and not that we can see the brain, but, you know, our emotions and how it shows up in our life. Sometimes I think not everyone can grasp that concept. But it's like a wound, right? You know, that we don't see on the surface. And so through that repair, we're able to heal that wound. And do you think that, for me, you know, I didn't know that a parent coach was an option to seek. So do you think that for people who maybe are in more rural areas, you know, do you have any advice for someone who would be looking to partner with a coach? How would someone get in contact with a person like yourself or another parent coach in their area?
So I want to say it's sort of a new up and coming kind of profession. I'm a licensed social worker. So yes,
Right.
I have a background in therapy, but I'm not wearing a therapist hat. I'm really a coach. I'm really your partner to walk you through this challenging time. And so you can just Google parent coaches in your area. The great thing is, a lot of us, myself included, offer parent coaching over Zoom. And so no matter what, we can always connect with a camera. And if a camera doesn't work, we can connect over the phone and just do sessions over the phone. A lot of parent coaches, myself included, again, offers classes. I offer classes and workshops. So that's another way that people can connect to parent coaches.
Okay, so you said something that sort of stood out to me, is that with the coaching aspect of things, maybe we're not as limited to state boundaries as we would be with a traditional therapeutic relationship. And so as a working relationship with a coach, we could go outside of our state much more easily. Okay.
Absolutely. I've worked with people across the country and even around the world. So
very, very nice. Okay. Very, that's great. I'm glad to hear that. Maria, where can we find more of you? Where can we learn about those classes you had mentioned and the work that you do? Do you have a website, social media, anything like that where people can connect with you?
Absolutely, and I would love that. I have a website. It's mariasandersparentcoach.com. And I also have a pretty active Instagram page, and the handle there is at Maria Sanders Parent Coach. And there you'll find updated classes, any other events or programs I'm offering, and of course, my one-on-one coaching.
Okay, great. Thank you for that. So thank you so much for joining us today, Maria. It's been a pleasure speaking with you, and I know that I'll be researching some things when I go home, so I appreciate that.
Great, and thank you so much for having me. This was a real pleasure. Thank you.
So Renee, I heard you had a chance to catch up with the very beautiful very awesome and amazing veterinarian, Dr. Tierra Hawley.
Yes, I sure did.
Okay, well, let's take a look at that.
So today we have Dr. Tierra Hawley, who is super mom, super vet, super practice owner. She's an entrepreneur. She's been a veterinary professional. She is a working mom. She's a wife. She's a friend. We're going to talk about a lot of things, because parenting is hard, and she is just, she's got it going on. She's got everything just firing on all cylinders. All cylinders.
Oh.
And you do so well.
I really appreciate that. Thank you so much for having me on this show. This is going to be awesome to talk about these mom topics today. Yeah.
So I actually turned to Tierra when I first had Gavin because I was breastfeeding. That was new. And you had been there, so share with everyone, maybe some successes that you had when you were going through it. One thing that I read a book right before I had Gavin, and, researcher by nature, I'm like reading the books, right? And one of the books I picked out was Intuitive Parenting. And that was really, I think, one of the best books I had read, was because the advice you get is this blanket advice, but every parent is different, every kid is different, every situation is different. And so for veterinary professionals, being in the clinic, you had two different experiences. Two different daughters at two different times. One you breastfed, one you didn't, right?
I did both.
You did
both. Just one longer. A lot longer.
Okay.
Yes.
Yeah.
Yes. Yeah, I mean, it's definitely two very different experiences. The oldest one, I was working full-time in practice when I was still nursing her. And then the youngest, of course, it's since I started my mobile practice. So a little bit more laid back, a little bit easier for me to pump when I need to pump, go home, visit her, nurse her, and then go back to work. And so with Cadence, it was a big challenge because in between seeing like 30 patients in a day, I had to constantly remember I need to go and
step
pump.
aside.
I need to go step aside and do this. And often I would forget to do that. So like the big thing is, if you're in practice, make sure that you like step up for yourself.
Yes.
And have your office manager or your boss schedule the time that you need to make sure you do that, because that's super important.
Yes.
Like, it's not something that you should have to neglect.
I feel nervous every time I have to step away, but I have to coach myself out of feeling it, because I don't want to feel shame every time I step away. I want to feel, good about it. But the clinic has to roll. I have to roll. It's going to be okay, and it does. It works. It really does. If you give it the chance to work, and because no one else. I mean, we're like our worst enemies. We're the only ones in our heads.
Yeah, I'm the only one in my head thinking, oh, I have clients waiting. They're going to be so upset with me, if I take this 15 minutes to go and do this. But really, if they are upset, it's okay. If they're not, most likely they're not going to be. It's fine. Like, it's totally fine. But really, most practices are able to accommodate for, nursing moms and pregnant moms, and providing them what they need during the day. So don't be afraid to ask for what you need to do that. Don't make the mistake that I made. Practicing.
Learn from each other. One thing, work-life balance, that's something I have been big on for a long time, just balance in life, emotional balance, mental balance, work-life balance. And I have, I guess, let's see, he'll be 9. So 9 and infant. And, that's ever changing. I think that's really important for people to remember, is that once you work with it, it's going to change in a month or so. But one thing that I like to do is maybe plan the month out, right? And figure out how much time do I need with my family to feel fulfilled, because I'm an introvert, so I need some time by myself, but too much gets me feeling sad and depressed and disconnected. So there's a balance there. And then, of course, we all have to pay our bills, and we love our profession. Like, what you want to be with those pets. And so you have to figure out what that balance is. Yeah. And I like to think about it like a dosing schedule. You know, like, what is the dose that I need? And then how do I make that work?
Right.
You know?
Yeah. Yeah, I mean, it's, and the thing with motherhood, it's constantly evolving and changing. Once you get comfortable and you've got it figured out, then you've got another challenge.
That really helps me.
You've got to figure it out a little bit again. That's totally normal. It's totally fine. For us, the wake up was, now we have school, and it's challenging. Yeah. Virtual schooling and me having to take the time I need from work to do that and sit with her, and the same thing for Quincy. So that's something new, but you learn to adjust to work through it. So now trying to make sure definitely to get the kids' clothes out ahead of time, have lunches ready, have dinner already prepared, because as the day goes by, you really don't have a lot of time to do all of those things unless you do them ahead of time. And it's, for me, like the easiest way to get through the day. And then at the same time, not forgetting to take care of yourself, right?
That's big.
Yeah.
That's super big.
So that's the most important thing. You can't do any of it as well as you want to do it without without taking care of yourself. That is a hard lesson to learn. I think it's one that we all have to learn. But whatever it is in the day's time that you really enjoy doing, make sure you at least do one of those things. So I'm a kind of an extrovert. So like, I'm an extrovert, but I act like an introvert. Most people think I am, but I'm not. So for me, I have to like get myself like somewhere. Like, so I like to just go out, do something, get out of the house. Like the other morning at like 5 o'clock in the morning, I jumped up and I was like, I'm just gonna go to the gym at 5 o'clock in the morning, you know, to hop on the bike. And that helped refresh me and get me, you know, started for the day. And so whether it's that or going out, you know, for a walk in the park, or taking a trip up to Raleigh to go to the mall, like whatever it is that I need to do to get out, that for me refreshes me a lot. Yeah.
That's awesome. I think, you know, there are some days where, like I said, that balance tips for me, and I've been alone too much, and then I'm like, can I tag along? Because I just need I need human contact.
You need human contact. You have to have people at some point to be around you. I do not do well alone. I like to be around people or places like all the time. So definitely, if I spend too much time at home by myself or with just a child, you start to get a little.
I was talking with another vet student, and she was sick, and I said, oh, well, we can reschedule our meeting. And she's like, actually, if we could talk, that would be great. Because I'm an extrovert, and because I'm sick, I haven't been able to go to classes, and I really need to talk to someone. And I was like, great, well, we'll just talk, and we can worry about the business some other time, but we just talked.
Yeah, it helps. I mean, whatever works, whatever you have to do those things. And
you really have to figure out what works for you, and what works for you on that particular day at that particular time. Because like I said, you know, on a Sunday, what's going to work for Dr. Hawley might work for her that day, but it's not going to work for a Monday. You know, so that's really important too.
I learned recently from a book. I can't give you the name of it right now. I think it's called Mastering Your Inner Mean Girl or something. I can't remember the author. But she recommended, like, on a sheet of paper, just write down 10 things that you really enjoy doing, like things that really, really light you up inside. And so every single day, you should at least pick one thing from that thing to do. And so that way, like you said, in different days, you might need something different. So you just go from that list, okay, this is going to work for me today. So I'm going to remember to do that particular thing.
It's like that well-being toolbox.
Exactly.
This is your self-care toolbox.
Exactly.
So you can always pull stuff out.
You can always pull stuff out. So maybe when it's a rainy day, you can't necessarily go out on a run if you need that. So you choose something else on the list instead. Watch a comedy, you know, movie or something, whatever works for you. You start to learn things about yourself when you look at your children. And you look at the things that bother you sometimes. So you start to learn about yourself. For me, patience. Like learning
Patience.
Learning patience.
And we can translate that into the pets and the clients.
Exactly.
And your professors and your students, you know, like wherever you're at in the field. Patience is...
Yeah, so your children can help you become better, you know, veterinary professionals or whatever your career is. It can make you better because you learn the things in your, you know, the little quirks that you have that you should probably work on a little bit.
Yes.
Yeah.
That's fantastic. I love it, you guys. I know everyone's just in their minds, just examining their lives right now, pointing things out. Well, thank you so much for being on with us today. This has been really enjoyable for me. I love when I work with you.
Yeah, awesome. It was so fun. Thank you so much for having me.
That was some really amazing information that you all shared, and I could honestly listen to the both of you talk about parenting for the rest of the day. Yeah.
It was fun.
Seriously.
Yeah.
It's good stuff.
Thank you. Yeah. It was a good time with Dr. Hawley.
Yeah.
Yes, it was good.
My boo.
Always great to work with her. She's fun, just equal, you know, just she's fun. She's got a ton of knowledge to share. I appreciate it.
And you know where she gets that from, right? Me.
Speaking of amazing moms, next up, Dr. Natalie Marks, veterinarian, mom, and boss, is going to share with us some great tips on keeping safe.
Hi, I'm Dr. Natalie Marks, here to tell you 3 things we should all know about leptospirosis. When I was in school, this disease was considered a rural, large breed disease of hunting dogs, and those were the only dogs I tested. But we now know that this disease is found not just in rural areas, but also very commonly in urban cities and suburban backyards. More importantly, our patients testing positive for leptospirosis look very different now. They're small, most commonly terriers, and in fact the breed of dog right now showing the highest in-hospital prevalence for this disease is the Yorkie. If you're only looking for lepto in jaundice dogs, you could be missing most of your cases since jaundice only occurs in less than 12% of leptospirosis positive dogs. Commonly, these acutely ill dogs will show gastrointestinal signs like vomiting, inappetence, diarrhea, fever, and lethargy. But don't forget these lesser-known clues. Some patients will present with conjunctivitis and uveitis, others with petechia or ecchymoses, and up to 20% of patients with leptospirosis are chronic carriers of the disease, showing no signs or just polydipsia polyuria. When these patients come in, don't just perform a PCV total solids and a mini chemistry panel. Run that full CBC and chemistry and urinalysis all at the same time. Keep these 3 important findings in mind. Don't ignore possible thrombocytopenia on the CBC, which we can see in up to 58% of cases. In greater than 80% of dogs with lepto, an azotemia will be present on the chemistry panel. And lepto patients may have isocynuria or even hypocynuria, protein and bilirubin spilling over into that urine, and greater than 50% of patients will have glucosuria due to the proximal tubular damage from the bacteria itself. Although more veterinarians are screening patients for risk factors for transmission of leptospirosis, it's also equally important to choose that best vaccine for patient and family protection. This includes picking a vaccine that protects against the 4 most common serovars, protects against leptospiremia, thrombocytopenia, and mortality, and most importantly, protects against urinary shedding. After all, with so many patients never showing signs of the disease, it is so important that we help spread the stop. This includes picking a vaccine that protects against the 4 most common serovars, protects against leptospiremia, thrombocytopenia, and mortality, and most importantly, protects against urinary shedding. After all, with so many patients never showing signs of the disease, it's so important that we help stop the spread of leptospirosis together.
Wow. Thanks, Dr. Marks. For more information, check out stoplepto.com.
Well, this has been fun. This has been a great conversation about parenting, and I wish we could continue it all day. We probably could continue it all day, honestly. Yeah.
We could, because parenting is like endless, and
there's dog parenting. We could switch it over into animal parenting. Like, there are people who are dog moms and cat moms. When they come in, when the clients come in, I say, hey, Mom, can you stand back? Get your hand away from the dog's mouth. I'm about to draw blood.
Yeah, I
refer to them as mom.
Yeah,
and
I
dad.
was a fur mom before I was a human mom.
That's right.
For sure.
Yeah.
I think it prepared me relatively well.
Yeah. They're a little different.
They are a little bit.
I want to cage my kids sometimes. I've been tempted.
They are a little bit,
I've never
right?
done it.
But the fun thing is that when I was a dog mom and I would speak with people about human children and I referred to the dogs, they were really offended that I would ever. But now I feel validated in my ability to compare animals and humans because I have tiny humans, and so I feel 100% confident in that. The similarities, and operational conditioning. It's still operational conditioning whether you are a human or whether you are a dog. The premise is the same.
Yeah, and there's a lot of research being done right now, comparing and showing the importance of pets as being part of the family, as being family members, just as important as a human son or a human daughter.
And it can work in a way that we underestimate sometimes, like dogs. Oh, it's just a dog. It can't do that. It doesn't understand a full sentence, or it doesn't understand this or that. But they do,
Right.
So it can really change the way that you interact with your dog, the way that, your dog has a relationship with your child, things like that. So, yeah, absolutely. Cats, same. Animals are animals.
Yeah.
Sometimes people are animals,
Yep.
Yeah. They
Name one.
are.
Just kidding.
No, right. But you come home and they're just like, I don't know, running through the house like little banshees.
Speaking of coming home, favorite part about fur parenting, they're always happy to see you. Sometimes I come home and I'm like, kids, I'm home. And they're like, Dad, go somewhere.
Yeah.
Yeah, they're not thinking about me, But my dogs are always like,
yes.
yeah, really excited to see me.
Gavin's in this stage, when he was a newborn, he was less expressive. And then he got into this stage where he's like, and it's so fun because sometimes it's like you come in and he's like, and he just gets, he's like straight face, he recognizes, and then does the same thing like your pets do. It's just happy,
Right. And you feel good when they do that.
You do.
And when they don't, you're just like, dang on it, man. This really sucks.
Okay, you guys. So we enjoy talking about this, obviously, and we also enjoy hearing your guys' experiences and sharing your take on what it's like to be a parent in this profession. So if you guys would like to, drop some comments in the comment section below. Share your experience. If you have more questions, drop those in the comments below. We can address those sometime. Follow us on our social media at MyVetCandy. Otherwise, you guys, that's it for us. Thanks for joining us for another episode of Vet Candy Life.